So today we're going to talk about rehabilitation for muscular injuries, looking at those different stages through for the early stage of injury through to the late stage of injury, what we might do within clinic, maybe give some examples of case studies that we've dealt with, and maybe just to help you if you've got any injuries occurring. So in terms of the injuries, what would we be looking at in
Your
terms?
top muscle injuries.
Yeah, which areas would you say people come in and say, I have a muscle injury and it is located?
Definitely just muscle injury, probably your mainly lower limb. So I'd probably say if it was more of a strain, it'd be like calf, hammy, quad. If it was more of a not sure, but it's muscle related, a lot of like upper body, so like trap related injuries.
Yeah, I think calves is probably a top one in it for just generic muscle strains. People come out, I've done this, I've done that, done the other. But again, quite interesting how people define that. I've got a tight calf, or I've got this, or I've got that, and having no specifics whatsoever. Do you know? So I've got a tight calf, and I'm all right for a couple of weeks, and then it goes again. But pain settles down, and then it goes again. And they seem to be okay with that for whatever reason. They sort of put up with it for a long time. I can get a few weeks into my training, my calf will go, I'll have a week off, and then it'll come back in again. And
they don't get on top of it.
Yeah, and that's something you'll see a lot with soft tissue injuries, especially where the pain will be quite intense, quite early doors. Give it a day or two, you generally start to settle down quite quickly. And the mistake a lot of people make is they categorise am I in pain, yes or no. Pain settle down, which then they think that means it's functionally right again. And then they'll go back into training, it'll go again, and then they come in with the comment of, I have a recurring calf strain. And it's like, well, no, you don't. You have the same calf strain, which you've never actually rehab properly from however long ago it started in the first place. You've just put up with it. It goes again, it goes again.
12-year calf injury.
Yeah, I've had this calf strain for 12 months. It's like, why? So there's no need for it. And a lot of it is purely simply just ignoring or refusing to do any sort of rehab on it, or not knowing what to do with it.
Yeah.
I think, so soft tissue stuff, that seems to be a common pattern, I think.
Yeah, I would say that. I think as well, like with that, it's actually understanding the healing process. Yeah. So from an acute aspect, you're going to be looking at that sort of 3 to 5 days where it's going to be kind of in that inflammatory phase. Obviously, it's not as black and white that, but you're going to then move into the next phase, which we call the proliferation phase, where there's new tissue being laid and all the combined with the white blood cells taking stuff away, and then you're looking from sort of 21 days at maturation phase, where we're looking at is that new scar tissue forming. So my analogy is a bit like a wall that's been knocked down. And then that inflammatory phase, you've got all the different components.
Everyone's helping.
Taking the stuff away, clearing the site, and then you've got the new bricks being laid. But you have to load it correctly. So the bricks are just chucked with the cement, it'll all be sort of in a random pile. So we have to get those bricks lined up. But at that stage, really jelly bricks. So then from the sort of 3 weeks onwards, then we're looking at how those bricks then get hardened and then are we able to withstand the stress. And that's where obviously scar tissue is a little bit different to the original tissue, but we have to accept the limitation within that. And then, like you said, why they get the recurring, because between the combination, either they're not allowing it to heal, so picking the scab, so it's never getting that healing process, or the wrong tensile stresses are basically going through a cellular level, and then obviously you get then chronic sort of inflammation. So we have to really look at that. And then, so what would you do Teresa, what do you think?
Just think it needs to be, like you say, guided along those stages. So if it's an acute injury that you've got your hands on, because I've often had injuries that are even years down the line, a few just specific to sort of maybe knee stuff that people have had gone on, or old ACL injuries, and they've had quad tears, and they've come in and they've I've always had an issue with my quad, and it's boulders are in there because it's just thick with scar tissue, and they keep straining the quad, and it's but your quad, it's because it's it's a mess. It's they've gone through that the trauma to the tissue. The collagens try to rebuild this healthy tissue. It's just there's too much going on. They've loaded it too soon, and they just keep coming back, and that muscle is just really, really weak. They can visually see it's dystrophic. It's like a skinny quad compared to the other one, and they're wondering why it keeps tearing, and they're wondering why the knee feels a little bit rubbish as well, because that quad's just not doing what it needs to do. But in terms of like your more acute ones, it'll be like obviously manually working on things in terms of like manual therapies at the right stages and intensities of that, but then loading that muscle. So if they are sporting or non-sporting, make sure they're moving it as they should and slowly building up from there. But muscle injuries are completely different to tendon injuries, and muscle injuries can be a little bit more straightforward in terms of time frame if it's just a bog standard muscle injury that's not been brought on from other factors such as nervy issues or referred pain.
Yeah, that's the point.
Yeah.
That's the point. Especially we've had someone come in and we can 99% rule out the nerve or the joint or the ligament or something more sinister as well. And that's I think you're right there. Just getting that, it's hitting that load, because what you said there, hitting that load at the correct point will make a big difference, won't it?
Here's one for you, little game. So only one. Give me one mistake that people generally always make when it comes to soft tissue injuries, in terms of the whole from start to finish. Give me one mistake people will make. You can guarantee you'll see it at some point in a week.
Too much too soon.
Yeah, I was going to say that. Too much too soon. Yeah.
For me, one thing I always found is stretching.
Oh God,
Why do people stretch the toe muscle? Like they'll come in and dead stiff, so I've been stretching it. So it's like, right, so you've got a hole in your tissue like that that's trying to heal. So you stretch it even more.
Lengthening it, yeah.
And they go, oh yeah, never thought about it like that. It's one thing I always found, because you get that stiffness when you go through that healing process. I get it, like it feels stiff, so you naturally want to stretch it, but
well, it's that yeah, sometimes as well, like, it's what I say, less is more, isn't it, as well? Like you said, you can do a heel raise off a step, but that might not be the appropriate thing. Because you get your range, we build that range up, like you said.
Yeah.
The loading isn't just, right, we'll go from 5 kg to 10 kg to 50. That's not, that's part of that progressive overload, but it's also about working within that range. And I think the quads go with us, like we're thinking the main quad muscle erect fem, because it's my favourite word, a biarticular muscle. That's my favourite word.
2 joints.
That's but it's basically, it needs to be able to work through that low range. And then if we go right to the end where you're generally weaker, so my analogy for that is, you see people in the gym and they're really struggling with a bicep curl here, and the pal helps them, like, yeah, I can do it.
Or they do them like this, bicep curl.
Well, they do them like that,
but short range.
If that person who's struggling here, because they've taken out gravity, so if you've got them to lean forward, they go back to here, because you're strongest in your mid-range. So sometimes we can do that, we can work mid-range and then work out.
Specifically.
From a sort of a strength point of view, which is really good as well, isn't it?
That's something that I don't think people realise with rehab, is progression isn't just adding weight. It's reducing stability, it's increasing time under tension. Yeah, variables are a great word for it. Your big variables is sets, time under tension, repetitions, frequency,
intensity.
Like I said, intensity, lack of stability, bi-leg to unilateral, that type of thing. But people just go, I must be getting back up banging on more weight. And it's like, right, well, great. So you're increasing your peak force. What about your velocity? What about your capacity? What about all these other things?
Rate force development.
And they just sort of go, oh, I never thought about it like that.
I think with
squat, so I must be getting better.
With that as well, it's about, my analogy there is, it's like, like if you've ever done any mixing, you're like, you get like mixing music. So with the music, you've got different.
DJ mixing.
No, not DJ.
What did you do there?
DJ.
I never do that.
No, this is more to do with like if you're like producing music and you've got all your different. So you might have obviously your lead singer, your guitarist, your drums, bass, but then you might have other instruments kicking in. So you have to change them all. You don't whack them all to the top.
Yeah, true.
So at some point your bass will be higher.
Where'd you get all these analogies from?
Loves it, isn't it?
Loves
it. Sits at home writing them all day.
My music background.
Sits at home. That's a good analogy. I like that one.
It's and that's basically, you just got to think about that, and you don't do everything all at once. So you just and also as well, the good thing for us, our background, because whilst we are musculoskeletal clinicians, we've also got that exercise physiology and exercise science background. And that's what I really enjoy as well, is that we can approach, especially towards the late stage of rehab, we're going to start to apply some of those principles within the rehab. So you kind of blend in the rehabilitation with the sort of the sports performance or the exercise performance. And that could be something from someone who wants to do a marathon, someone who's doing like plays like regular sort of team sport, but it could also just be someone who wants to get back walking. So you apply the right principles,
Yeah, exactly.
and then tailor it so you get those goals and what we might call, you could call it sport specific or activity specific.
Life specific.
Yeah, exactly. And that's what and especially I quite like that with muscle injuries, because you can really, like you said about it, it's once you rule out all the exercise and stuff, if it is just muscle, it's probably the one you can sort of almost go within a reason, go step by step through that process.
And touching on that as well, we obviously we always take into account the actual what the muscle needs are, but why has it happened? So if it's not contact or overuse, has it happened because of like the mechanics? So it's like we're taking into account that as well, aren't we? Because it's like if they just pulled the hammy and it's just hammy, that needs a slightly different. So it's a hammy because the back's stiff, so the hammy's been more susceptible. So it's taken into account all those.
That change. Yeah, exactly. That's so you're looking. Yeah, so you're not just like say not just like, okay, I need to do a hamstring work, and obviously I like especially with, I mean, the hamstrings, I'm quite big on eccentric work with hamstrings.
Yeah.
So the reason for that is if you're doing high velocity, like running, but particularly like football, rugby league or whatever, rugby union,
Well, that high velocity rugby union. Bit questionable, really.
I got to say, no comment. And then you've, or even a cricketer, but like a bowler, thinking of someone bowling, but certainly like those twisty turning, high velocity, braking forces, people don't think about that.
Yeah, true.
So when you're running, every time you run, you're also braking.
Yeah.
And that's where the eccentric is important. So for that, we obviously know that if you use a bicep example, we know that's a concentric, but if you're dropping your weight down, so if you're
lengthening the
a
muscle.
weekend, if you're in a pub in a weekend and you've got a tray of drinks and you slowly lower that down, that's an eccentric contraction. So as we know, that's important for running.
Lengthening while strengthening.
Yeah, lengthening and strength are hugely important, especially for muscles, isn't it?
Again, just reiterating your point before, Gus, we were talking about the sort of spectrum and the different variations of people you'll see, but applying the same principle to it. The question I ask a lot of people is, what do you think of someone being fit? Like, are you a fit individual? And people go, oh, it means that you can run, or you can lift weights, or you've got a six-pack, or whatever it might be. And I was like, no, it means fit for purpose. And fit for purpose differs from one person to the next. So if you're a little Doris that wants to bake cakes, but you can't because of your dicky arthritis in your wrist, then currently she's not fit for purpose. When her wrist is feeling better, she can do it, she's fit. Do you know, that's what she wants to do. If you're an office worker who can't work because of a disc pathology in the neck, she's currently not fit for purpose. But get her better, you're fit for purpose. All right, yeah, she might not be.
HR might say something about that.
You what?
You might get a HR complaint.
Well, but
I know.
But she might actually be fit for purpose to do that role. She might not be fit to go to the gym, but she might not be her personality type anyway. Do you know what I mean? So it's just making sure we understand somebody's goals, and then scheduling and periodization or planning how we're going to get them to their end goal, basically. And it might be something as simple as office work, or it might be, like I said, running a marathon, whatever it might be. It's just understanding people's goals and how we're going to get from where you're now.
I was thinking, I had someone the other week who does a lot of long distance running, and then for some reason I don't know how we got into the conversation. I think maybe he was asking what I'd done at the weekend, so I'd been playing football, and he was like, oh God. Yeah, so like, and he was like, done a bit of football, and after, like he said, I could do the marathon. A week later, I did this charity game, and I was in tatters for a week after. It's like, well, yeah, but it's because your body's, it's just what your body's adapted to, and the different energy demands that, they sort of, obviously classically we talk about fast twitch, slow twitch muscles, but those are all important to understand that from a rehab point of view, because there's no point of giving someone who needs to be doing explosive work, sort of high intensity. So we'll look at high volume of sort of repetition, for example. So you might give someone who's an endurance runner like 12, 15 reps or something, but then you might give someone who needs to do more explosive stuff, you might lower those reps, but also within those reps you might create, so like if you're looking at a squat, you might want to try and get to do some form of explosive range within that squat, whereas a runner there might be slightly different variations. So it's just there won't be a massive difference. You're not doing like 1-on-1, but you might just tweak it, and that's again what we can hopefully help people.
Again, it's understanding the tissue type as well, isn't it? Because again, you're talking about rep ranges. I've actually spoke to someone this morning about it. The classic example of that is when you're doing anything calf related. So if it's more of a soleus strain you're looking at, if you're only working on reps of 10 for a soleus, you're only scratching the surface because the type of muscle that it is, it's very slow twitch, it's a very high endurance muscle. You've got to be hitting 20-25 reps per set to get anywhere near an adaptation. There's a gastro, like we talked about before, massive, really big, powerful muscle, explosive sprinting muscle. Your rep range is realistically 8 to 12, depending on sports types. So it's understanding the actual muscle that you're working on.
Like the different physiology of it. But that's why I think it's a good topic to talk about muscle, because you think, oh well, surely, even within that, like we say, it's quite good because you can see sort of, especially from acute stage A, B, C, D. It's probably one of the most, if you can get a most lineal sort of aspect of our job.
Yeah, you know what you're getting from it, don't you?
It's not as nuanced as like a nerve injury, but even within that, it's quite. It's good to work. I think
it's important to respect the different stages as well in terms of the strength as well. Don't just like skim past one of them strength stages as well. So like your isometric, it's important that we're ticking that off. It's important that we're ticking off your eccentric, your plyometric, that we're giving the muscle back all of its developmental needs so that it can be back up to performing.
Point. Yeah, I think, and because like I said, just because I've sat down, it's easy to use bicep as an analogy, but you don't just go straight always into the concentric. Isometric, really good for low level. Just like, and there's some evidence with tendons as well, but like showing that it can reduce pain a bit, isometrics. Then we get the eccentric, we obviously know that's really good for strength gain. But I remember, again, when I did my master's, looking at sort of people often forget about, it's almost a foundation, like a triangle, and they forget about the strength, and they want to go to the explosive. Oh yeah, I want to do squat jumps, but you haven't got your sort of your basics. It's like a lot of things in exercise and people looking for the 1%ers, but forgetting about actually you can gain a lot from getting your strength right, and that's
the meat on the bone.
Or you get like people, I'll have said, for example, a runner, because it obviously can run in multi-sports, but it'll be like, a few weeks in, right, can I run yet? I'm like, whoa, hang on a minute, right, have we done like your change of direction? Have we done your plyometric stuff? No. All right. And it might be like, we may do running up, depending on their injury, and slowly build it up, but we ain't doing anything fast because you've not ticked off that box, you've not fed that muscle back what it needs yet to be able to be safe at that, to be back in that environment.
Capacities. You've got to have that, you've got to be at that capacity level.
There's one that always seems to shock people, just talk on calves again. I always do a capacity test for people with calves, single leg calf raise. How many can you get out before your calves start
I understand what you're going to say.
Your gold number is about 33, depending on age and genders and stuff, but roughly about 33 for endurance sports. It always amazes me when people go, yeah, it's feeling great, yeah, it's fine, and they might do 30 on one leg, and on the other leg they're doing like 12.
I'm like, it's starting to cramp now.
And it was like, stiff that, and I was like, well, yeah, it's not got the capacity yet. And then they're asking you exactly the same question, can I run? I was like, oh, you tell me, what do you think?
I was for some reason doing 25, but it's the same sort of because I can get, I was once an older at 25, I'm like, right, you're going to be able to. But it's, I suppose, maybe that'd be sort of final thing for me on this is if we're talking about getting back to sports, you're talking about running, I talk about the reverse donut or the donut basically. So so I'll show them that's the idea. That's 30 minutes because from an adherence point of view, because that's the other thing. I want you to run 5 minutes. And I'm like,
what's the point?
So 30 minutes, but in the middle, that donut is a 5-minute run. You can walk 10 or 15, run 5, walk 10 or 15. You can do that 2 or 3 times. I don't mind it being a bit grumbly for sort of 24, 36 hours, but once certainly 40 hours more, then that's not quite ready. But that's your goal, your threshold to be able to manage. And then once you can pass that, then increase it 2 or 3 minutes at a time. So basically, every second or third run, increase it 2 or 3 minutes. Leave it sort of 48 to 72 hours between you run. And then as time gets on, then we can increase it. And by the end of it, the donut where it's a small hole in the middle, it's a big hole.
Mhm.
So it goes from a unhealthy donut to a healthy donut.
Yeah.
They're just a thin piece of red all around. Yeah,
Another good analogy
I
there.
love a healthy donut.
yeah. If there's such a thing.
No, I don't think so.
Right.
Um,
Any other things?
Yeah, and last thing for me, talking strength training, if we're going through that full stage, is one that constantly gets forgotten about is plyometrics. So your ability to reproduce, to accept and then reproduce force quickly. People get to a point where they think, oh, I can weight lift this and I can do that and I can leg press on single leg, whatever it might be. And then they go, right, well, can you hop as many times on that leg as you can on that leg within a minute? And can you produce that again and again and again for set after set after set and hit the same sort of numbers? And even something as simple as getting someone to skip to a metronome for 170 beats per minute, they find it a real struggle, or they end up sort of fatiguing, and all of a sudden that sort of singular jump, they end up sort of jumping around like in big circles because they can't reproduce that contact force. And it's only having to do little bits like that to showcase how poor their ability is to do that before they actually listen and say, all right, well, maybe I do need to do it. Because again, running multidisciplinary, it's basically jumping from one leg to the next. So for whatever reason, people don't categorise it as a jumping sport when it massively is. It's jumping from your left leg to your right leg repetitively for however long. So plyometrics for me, I ram it down people's throats. Before I'm happy for someone to work running, I want them to be able to reproduce certain numbers in plyometrics. So then I know it's safe, they know the tissue can cope with it, and then exactly what you're talking about there, just start progressing the sort of run walk,
Yeah,
the
exactly.
distance of the duration.
And the thing is with the plyometrics, is the key aspect is that that sort of space between, if you're talking about jumping, so obviously the stretch shortening cycle, don't we? So that if they land and they go bang, and then they switch the legs over like that, and then they wait, it's got to be bang bang. Like, it's got to be really quick, hasn't it? So basically, like the amortization, the phase needs to be very, very like almost non-existent. But you can then, if someone's struggling with that, you can progress that, can't you? So you can allow them. So my example would be a squat jump. So you get in a squat position, hold that position, and then jump and back down and hold it for a second, 2 seconds. And eventually progress that, shortening, so they end up getting to the counter movement jump, which is down and up. I think that's the key point, is it understanding what you said there, understand the difference between a squat jump and a counter movement jump. The one's a plyometric and one isn't, basically. But you can build up to that. But you've got to be able, but that gives you, like someone, you said you're happy for him to go out. You'd be happy then for him to go out once they've hit that. You could do a counter movement jump on a regular basis, which means that, really good quality. It's quality over quantity. I don't know what your thoughts.
Yeah, definitely. Yeah, agree.
Yeah, okay.
Agree.
Brilliant. So a few advice there through the stages of rehabilitation from muscle injury. Some examples around those areas of the joints and the muscles that are linked in, and how we improve sports performance, activity specific as well, and some little tips around explosive work.